Good morning, everyone. It's so nice to see everyone gathered here this morning. My name is Christina Talbert-Slagle. I'm a faculty member in the School of Medicine, and I'm before you today in my role as director of the Faculty Support Initiative for the Yale Institute for Global Health. And I'm just going to take a very short period of time to introduce our presenters today, of whom we are so proud, and we're so excited to support these faculty members. So we at the Faculty Support Initiative offer a few funding opportunities to our 240 plus affiliated faculty. So as you're aware, the Institute arcs over the three schools, medicine, public health, and nursing, but also we think of ourselves as serving and supporting faculty across the university. And among the ways that we do that are to offer what we call seed grant opportunities. So just a quick overview of what these are, and then you'll hear from three of our seed grant recipients, and they'll share with you about their amazing work. So first, we offer something called the Global Health Spark Award. And the Spark actually is a very intentional name. We're proud of it, but because the idea here is to catalyze. All of these are about catalyzing, seeding, supporting faculty and their amazing ideas, partnerships, questions they want to ask, collaborations they want to build. The Spark Award is for YIGH affiliated faculty individuals as they identify, coordinate, and or prepare for global health work. So the Spark Award is $10,000, and it's a short application. For those in the room who might be eligible, the application window is open, and the deadline's in mid-May. I'll show you a slide on that momentarily. We've actually been able to spark some wonderful, wonderful work through this seed grant, and so we're very excited about being able to offer that for our faculty. The next opportunity is called the HECT Global Health Faculty Network Award. This is $50,000. It's meant to support what you sometimes hear as team science, but really just acknowledging that global health is really about collaborations, about people coming together with shared interests, shared ideas, shared excitement. And we have the faculty networks, which my colleague Jeremy Schwartz runs this program for YIGH. So members of our faculty networks are eligible for this Global Health Faculty Network Award. This has been at Yale for a long time and actually is funded by one of our faculty members originally a long time ago, and he's been a wonderful supporter of all the global health work, so we're very grateful for that. And then this year we're launching a new opportunity, the Global Health Innovation Education Awards. So these are, as you can read, for faculty-led projects advancing global health education. Very excited about this, acknowledging that it's certainly about practice, certainly about research and collaboration and partnership, as you've been hearing, but it's also about the next generation and thinking of ourselves as educators. So how can we at YIGH support that part of our faculty's work and mission? So these four awards are $10,000 each. Sorry, I have to call. Two for faculty from the School of Medicine, one for faculty from the School of Public Health, another that's offered through the Office of Global Affairs and Planetary Health to be led by faculty from nursing. And as you might imagine, they have to incorporate learners and trainees in some various ways. We have a lot more detail about that on our website. So just the deadlines, still plenty of time. The applications are due on May the 18th, and applicants will be notified by the end of June. So we're very excited. We hope we have more this year than every year prior, and just very, very proud, especially in this moment, to make sure we signal to our affiliated faculty, we see you, we support you, we want you to continue building, collaborating, expanding your wonderful ideas in global health. So here is the QR code if you want to take a snap of that. We're going to have an information session on April 23rd, and we will record this for those who are not able to attend. So with that, I am happy to, let me, I guess, go back. I'll let Eleanor start her own slide, but I'm going to introduce, quickly. We have three seed grant recipients who are here with us today. Eleanor Reed, from whom you'll hear momentarily. Nikki Hawley, from whom you've heard in a different capacity, but she also is going to be talking about her work that was supported by YIGH, and Sunil Parikh. These are friends and colleagues of mine, and we're just, again, delighted through YIGH to support these faculty members. So, Eleanor, happy to hand it over to you.
All right. Good morning. And thank you. It is truly an honor and a pleasure to be here today sharing the stage with distinguished speakers and guests. I also want to make it clear that I share this stage with my Ethiopian colleagues and research team that's not here, but without whom the past decade of research that really led the foundation for this project, none of which would have been possible. So as you can see by my title, I am going to be speaking about a project that is really centered on improving access to palliative care in Ethiopia. There's a lot of themes we heard this morning, and I'm excited to carry those through in this talk. That was not planned. I had no idea what the panel was going to say, but I think you'll hear a lot of recurring themes. Okay. So the most important things to know are first that in Ethiopia there is a tremendous need for palliative care. My colleagues and I and other researchers have already demonstrated the effectiveness of palliative care in this setting. We've also shown the avoidable suffering as well as the out-of-pocket costs that accumulate in the absence of palliative care, how this leads to medical impoverishment and acts as a catalyst in the poverty cycle. There also are demonstrable barriers to the uptake of palliative care. And I really think of these in three ways. I think of sort of the patient-facing barriers, and a lot of those are cultural, provider-facing barriers, that's education, and then supply chain, like access to analgesia and particularly morphine. I want to speak for a moment about what an idir is. It's in my title and it's critically important. I don't know if there's any Ethiopians in the room. There should be one student. Hi, Merat. Okay. So idirs, and correct me, Merat, if this is wrong. So idirs are indigenous neighborhood self-help organizations. Traditionally, they were burial societies, but in the modern age, they're more multifaceted. They exist within neighborhoods all over Ethiopia, from Addis to rural areas, and they're really an important social structure. And so with the Spark Award, what we have created is a sustainable, scalable, Ethiopian-led model for home-based delivery of palliative care using community health workers within IDIRs. And so our community health workers are trained in recognizing neighbors who may have unmet palliative care needs, who may be suffering, and then linking those neighbors to Hospice Ethiopia for home delivery of palliative care. A couple study milestones. So at the very beginning, we worked on our study protocols and documents. We received IRB approval both from the Addis Ababa College of Health Sciences as well as Yale. We collaborated on an editorial on the role of the IDIR and then identified stakeholders. I am going to put Merat on the spot. There's a wonderful undergraduate in the room who starred in this teaching video here that was in Amharic and about having difficult conversations and talking about illness. This was when we brought my colleague Ephraim Abatun, who's my main research collaborator. We've been working together for over a decade. We brought him to Yale, and we used the Simulation Center in the Department of Emergency Medicine to create this video. And then after many coffee ceremonies, we started our study. And so we are currently enrolling. We've got a couple more months of enrollment before we wrap up. Our goals are really threefold. So the first is to recruit and train our IDIR community health workers, and I would add also maintain them. The training needed to involve these kind of soft skills that we talked about with collaborations earlier, how to identify suffering, how to approach people who may have physical or psychological suffering. And then provide this link to Hospice Ethiopia. That previous slide showed Ephraim Abatun. He's the executive director of Hospice Ethiopia, a nurse who went on to do a PhD in palliative care. And then our third goal is to demonstrate this increased uptake, this improved access to palliative care, by expanding, task shifting the palliative care workforce and using our IDEAR-based community health workers. I have a couple minutes for questions.
Thanks. Oh. Sorry.
Tracy?
Yeah. Thanks so much, Eleanor. This is fantastic work. And I'm wondering, sort of, even as you guys are thinking about, building the evidence base for this intervention, I'm wondering if you could talk at all about what work has been going on more of the policy level to think about, okay, how are we going to get support for rolling this out in the country?
Thank you. That's an awesome question. Yep. So the Ministry of Health, in collaboration with Hospice Ethiopia, now has national palliative care guidelines. And so that has helped tremendously. The other huge piece to this, and I could talk forever. Someone's going to have to carry me off this stage. There's Mike. So it has to do with morphine production, which is now starting like this month, will be in Black Lion Hospital, similar to the Uganda model where they make their own. And so that has been a huge issue. And I could talk a lot about that, but that is starting reconstitution of morphine in Black Lion Hospital. Yep. Oh, sorry, wait, Luke had a question. Yeah.
Could you talk a little bit about the local attitudes towards opiate therapy and pain control in general, and how you approach that in this project?
Yeah, that's a great question. So local attitudes, stoicism. Okay, so pain is not something that patients themselves will bring up in the presence of a physician, and physicians are not necessarily trained to really inquire about it. And so it's that was one of the barriers, right? Is actually treating pain, this idea that pain is the fifth vital sign, right? And so overcoming that has been a couple different, I put that in one of those barriers we talked about earlier. From a patient-facing side, working with Hospice Ethiopia to give patients the sort of, inform them that they can absolutely have the right to have pain control, that they can ask about pain control, that there are multimodal areas of, that we can treat pain. On the provider side, there's now, we do regular lectures for the entire medical school. And so teaching about pain control and the WHO analgesic ladder. I would say that has been one of the sort of cultural and education barriers, and then the access that Tracy just mentioned, but that has been a huge part of all of this as far as a barrier. It's just treating pain, yeah. I think there was yeah. Oh, sorry. Okay. Thank you.
All right, well, thank you all so much for being here. I was not expecting to be quite as involved as I have been this morning, so grateful for all of the wonderful questions. I, like Eleanor, am going to acknowledge the people who are not in the room right now but are key partners in this work. First is Dr. Sarah Lowe, Associate Professor of Social Behavioral Sciences here at the School of Public Health, who's actually my co-PI on this project. Our shared PhD student, Emma Mew, who did much of the foundational work to get us to the point that we are right now, and our key partner in American Samoa, Dr. Etta McCutcheon, who is actually the sole psychiatrist in American Samoa. and really the catalyst for this work. And I want to thank the Institute of Global Health for this incredible opportunity and this funding, which has been so transformative on many, many levels for my career and that of many others. So I'm going to talk to you about the project that we are just beginning, having received funding late last year, that is focused on mental health in American Samoa. And those of you who know me in this room know that I am a diabetes researcher. I'm a hypertension researcher. I think about obesity and its risk factors. I am so far from a mental health researcher, or at least I thought I was. Over time, as we've been implementing programs to tackle diabetes, hypertension, prevention, treatment in American Samoa, we've had consistent struggles with engagement. People don't show up to sessions, people are not able to be adherent to medication, and the foundation of much of that is psychological distress, trouble coping with their conditions, and just the pressure of everyday life. And this became more apparent to me over time. And then during the COVID pandemic, this all really came to a head in American Samoa. This is a 77 square mile territory of the United States. Many of us really don't even think about the fact that it exists on a daily basis. Very, very small place, 44,000 people. And in 2022, there was a cluster of 11 youth suicides. And this just rocked the entire community. And it uncovered, really was the tip of the iceberg for what is now understood to be a major crisis of youth mental health that is undermining our capacity to do anything in terms of improving physical health outcomes. Some of my colleagues in the nonprofit organizations in American Samoa rallied very quickly after that, and in our own work that followed it, we're now seeing that 1 in 3 high school students in American Samoa has seriously thought about suicide, at least once in their lifetime, very often recently, and many, many of them have at some point got to the point of having an active suicide plan. This is something that I, as somebody who's been embedded in this community, even as a non-communicable disease researcher, cannot ignore, and was asked to come to the table to try and bring some of the learnings and the solutions that we have thought about in diabetes and hypertension to this issue of youth mental health. So over the course of the past 3 years, we've really pivoted a lot of the work that we've been doing in American Samoa to focus on this topic. And again, I want to just acknowledge my PhD student, Emma Mew, who led most of this important work. She managed to, during the pandemic, when nobody could travel, develop virtual relationships with colleagues in American Samoa and engage the entire mental health infrastructure and stakeholders in qualitatively thinking about what their key challenges are for youth mental health, what the gaps are in current service provision, and how we might address them. Many of these gaps actually came down to family. And family is a huge strength in American Samoa. It's a very collectivist society. Love and support of the family is a really important thing, but it's also a double-edged sword. It's causing a lot of pressure for adolescents. There are intergenerational issues of communication where kids are feeling like, with the advent of social media, their parents are very rooted in this traditional Samoan values. They're trying to be part of the world. They're juggling school pressures, they're juggling anxiety, they're juggling the fact that they live on this tiny little rock in the middle of the Pacific, and there are very few opportunities for advancement in the way that social media tells us that we should now live our lives and aspire to greatness in our careers. And so what we decided to do was develop a parenting framework. This is a culturally grounded, American Samoa-led framework for parenting to protect youth mental health. The framework has 7 pillars that are around promoting and protecting physical security and safety, giving adolescents coping skills that will be able to help them navigate conflict and intergenerational relationships. And so then we are using that parenting framework as the grounding for this intervention. We reviewed a huge number of existing youth mental health interventions, cross-checked them against our parenting framework, figured out the one that probably fit the best, and with the support of the YIGH Project, are now going to adapt that intervention and actually implement it in American Samoa. So we are heavily into the first milestone here, which is the adaptation process. We're actually taking the Strengthening Families program, which has been used all over the world, to address this issue and build family skills. We created a stakeholder team who are going through the materials and doing the adaptation process to make this contextually and culturally relevant, and using this process of community co-design to really come up with our Samoan version of the Strengthening Families program. In a couple of months' time, when that process is complete, the goal will be to move into a single-arm trial where we will deliver this to a small amount of families, get a lot of feedback about feasibility, acceptability, how we might scale this with the help of local organizations, and then eventually we'll move into this waitlist control trial that is a little bit larger. So unlike Eleanor, who's done incredible work so far, this project is a little bit earlier in the process, but we are really just, again, thrilled to have the support of YIGH and looking forward to seeing where this work goes. Happy to take questions. We don't have a lot of time, so maybe if there are a couple, we could try and take them at once, and I'll bundle my answer.
Great presentation. I'm going to channel Christina. Have you considered the impact of climate anxiety in terms of the adolescents' mental health challenges?
Yeah, so we have some separate work that is thinking about climate and mental health. We have not yet combined the two of those into this program, but what is so nice about the Strengthening Families model is that there's space for these conversations among families to go in whatever direction they want to go. So climate, I'm sure, is going to come up at some point, but interestingly didn't in a lot of the formative work. Yeah. All right, I'm gonna give it to my next presenter. I'll even move the slide for you.
Hi, everyone. Can you hear me? Great. So my name is Sunil Parikh. I'm a professor here in EMD. I'm also in the section of infectious disease. I'm speaking on behalf of Jennifer Schur, is a professor in pediatric endocrinology, specializes in diabetes, and then my colleagues in Uganda, particularly Baylor, Uganda, which has one of the largest HIV clinics in East Africa. I think they take care of about 11,000 children and adolescents with HIV. I think what I want to highlight in the presentation, of course, thank you to Sierra and YIGH for the opportunity to do this project. I think for students out there, one of the lessons I think I've learned over time, and granted, as you get further in your career, you're in a better position to take advantage of multidisciplinary opportunities, but I think it's really to keep your eyes and ears open, read the literature, talk to people outside of your field. So this project is really outside in a lot of ways of my area of expertise, but I will just tell you a very quick story because we only have a couple minutes. But I have a grant that I have been working now in Uganda for about 20 years, focusing mostly on malaria, a bit on HIV. The landscape of therapy for HIV and malaria has changed over time. So in the last few years, dolutegravir has become the overwhelmingly most common antiretroviral used in Africa. And I'd say roughly 90 to 95% of the population of individuals living with HIV in Africa are now on dolutegravir. HIV therapy is also, malaria therapy rather, has also changed over the last 15, 20 years, and they use basically certain combinations of drugs. Those drugs can interact with one another, and dolutegravir in Western populations has been shown to increase the risk of metabolic derangements in individuals. But there hasn't been a lot of work done to look at what this wholesale change in sub-Saharan Africa could do to metabolic changes, especially in pediatric populations. So we have a grant that is starting. It started last year. Hopefully it will continue. Where the first aim is really to look at metabolic derangements in the children that were transitioned to dolutegravir in Uganda to see are there any early signs of glucose difficulty with glucose handling. lipid abnormalities such and other things. And then the second and third parts of the grant are to look at malaria-related EAMS. So the inspiration for this project literally came from an email from Dean Brown. So the deans of all the schools send out monthly emails kind of pondering on different aspects. So in one of her emails, I know most of us, I shouldn't say this now, but most of us hit delete or read really quickly. I happened to read this one, and she talked about the article that came out in one of the big journals about how it was interesting that G6PD deficiency is related to hemoglobin A1C and diabetes. And I saw that and I had no idea that that was the case. So I looked into it a little bit more. So to bring a long story short, G6PD deficiency was selected for by malaria. It affects about 400 million individuals around the world, and it has some protective effect against malaria. But G6PD deficiency also enhances or shortens red blood cell survival. Red blood cell survival is key in having an accurate hemoglobin A1C. So the way that you monitor and diagnose and monitor for diabetes control, and I think control is not the right word that folks use now, but the way you look at how your glucose measurements have been over time is you measure hemoglobin A1C, which is directly affected by red blood cell survival. So long story short, we had, again, I said that 3 times now, and we have this grant where we're able to follow individuals using continuous glucose monitoring as part of our trial. So with this funding, we're going to now test the children in this trial for G6PD deficiency using genetic testing, using enzymatic testing, and then correlate that with the glucose measurements that we're going to be doing already in the trial. So the goal here is, obviously, sub-Saharan Africa is dealing with not just HIV burden, not just malaria, but also non-communicable disease burden. So we're going to hope to gain some insight into whether or not there are other ways of looking at glycemic control in individuals with G6PD deficiency over time, and figure out if we can help to inform policy and guidelines. So using this funding, we will do some genetic testing of the individuals, some phenotypic testing, and then correlate those with different measures of glycemic control, ultimately hoping to put in for a larger funding opportunity. Thank you. So read your emails from the deans.
That's excellent what you're doing. I'm just wondering if you've looked at advanced glycated end products as another way to look at it, especially in children. There's ways to view the end products in the lens of the eye, also the skin. So I was just wondering if you looked at that.
We have not. I could phone a friend, Jen Scher, if she's thought about this. But we're actively thinking about putting in a larger grant to look at this question, because there's other factors that influence red blood cell turnover, obviously in sub-Saharan Africa, the hemoglobinopathies, many other things. So I think we see an opportunity here to really improve how folks with diabetes are managed in areas where G6PD deficiency are extremely common. I would love to talk with you afterwards if you have other ideas.
Thank you, Sunil, for a great presentation.
Thanks.
And our last presenter is actually not in the room, is over Zoom. And so I'm pleased to introduce Rob Hecht. Rob is a professor in the practice here at the School of Public Health. He is also the founder and president of a group called Pharos Global Health Advisors, based up in Boston. Rob has been a tremendous supporter of global health at Yale and the Yale Institute for Global Health. In fact, the Hecht Global Health Faculty Network Award is an award that he has sponsored now for many, many years. The other fun fact about Rob today is he literally landed, I think, at 6 a.m. From a trip to China. So I'm impressed with Rob's energy and enthusiasm to be with us today. He is going to present on a project that started now a couple of years ago, funded by the Macmillan Center for International and Area Studies. So in addition to seed grants here at the Institute, there are also, I would just mention to our colleagues here, other opportunities around the campus, like the Planetary Solutions has a recent call out, but Rob now two years ago was a beneficiary of the Kempf award, which is around kind of conferences and workshops, but they also have faculty awards. So Rob, I see you're on screen. Thanks so much for joining us after such a long journey from China.
Thank you, and thank you for inviting me to join. I'm sorry I can't be with you, but as Mike mentioned, I have some extenuating circumstances, but I'm just happy to be connecting with you in this way. And I've been listening in on the conversation this morning. It's great to see such energy and optimism in global health being expressed by the speakers and the colleagues in the audience at a time where we're going through this turmoil and difficult period in global health. So I find this all very uplifting. As Mike said, in addition to the catalytic awards available under the auspices of YIGH, there are other Yale-based opportunities, and the Macmillan Center is a wonderful source, I can tell you from my own experience. Over the last 2 years, my team has been able to take advantage of 2 awards from the Macmillan Center to kick off the work that we're doing in Cambodia and Laos around building national capacity in health economics, financing, and policy. Next slide, please. Somebody able to advance the slides? Thank you. The background here is that these 2 countries in Southeast Asia are working vigorously to improve their health systems, to reform things, to extend essential services to their all their population, and to provide a measure of financial support and financial security for their 25 million inhabitants, citizens. But their homegrown capacity to develop and appraise policies is quite limited. National public sector and academic institutions in Cambodia and Laos only have literally a handful of highly trained or well-trained health economists and health financing and policy experts. Such a contrast, not just with the US and high-income countries, but compared to neighboring countries like China and Thailand and Indonesia, Philippines. Cambodia and Laos, along with Myanmar, really stand out as being far behind in building national capacity. So the need here is tremendous. And we should be honored at Yale School of Public Health that we were asked by the director of the National Institute of Public Health in Phnom Penh about 2.5 years ago to help them to create and then to kick off the country's first concentration in the MPH program there in health economics and financing. We at YSPH in my team obtained these 2 awards, both under the Macmillan Center, as Mike said, for a total of about $40,000. Not a huge amount, but quite a bit to get us started to lay the groundwork for this training program, this capacity building program in Cambodia. The purpose of the grants was to start training this first generation of Cambodian and Laotian faculty to work on the program, to design a new curriculum from scratch, and to develop a proposal in the true spirit of seed funding for multi-year financial support. So this grant financing or grant resources from Macmillan made all the difference in kicking us off. And I can report in the next slide or two that we're making some steady and I think very encouraging progress in this area. The two grants are largely now expended, and the program in Cambodia, Laos is taking off as we speak. Next slide. So we had several objectives behind the two awards, and you can see here each objective and what we've achieved under the seed money that we received. The first goal was to train and get in place the Cambodian faculty who would work with me and others. I'll talk about this in teaching this, delivering this new concentration in health economics and financing, and become the future leaders of this program. And we had three highly talented Cambodians come to Yale a year and a half ago in the fall of 2023. They attended classes. I think they attended some classes that Sunil and maybe Nikki and Luke delivered, as well as other classes in health economics, cost effectiveness, and so on. They studied alongside MPH students at YSPH, and they presented their own research and their own experience in various seminars around the campus that Macmillan helped to host. Our second objective was to actually create from nothing, really from scratch, from whole cloth, the economics and financing track in this new curriculum. So we developed 6 new courses. This was approved last year by the Ministry of Health in Cambodia so that we could get going. I worked hard with the Cambodian director of the Institute to make this a multi-institutional support. It's not just Yale faculty helping to build this, but we now have a partnership with leading faculty from Hong Kong University and the School of Public Health at the National University of Singapore. We have leading professors from those institutions teaching in Cambodia as well. The third objective was to put together a 5-year plan and seek funding. And we were fortunate that as a result of the Kempf and Macmillan Awards, we were able to obtain a grant for $350,000 from the CMB Foundation to get this program underway. And we have requests pending with other Asian-based philanthropic funding sources, and I'm optimistic that we'll receive more funding this year. And then finally, the other objective of the catalytic awards was to stimulate interest and demand. We can build all the training programs that we want, but if nobody comes, then there's no point. The coordinator of this program at the National Institute, using the catalytic awards, promoted this both with the traditional full-time MPH students and mid-career professionals in the governments of Cambodia and Laos who could benefit from and are interested in this program. We received well above 40 applications, and the Cambodian faculty and I selected 20, 15 from Cambodia and 5 from Laos to be in the first cohort. Next one, please. Next slide. These two pictures show one of the 3 Cambodian faculty, the coordinators, Savina Cham, when she was at Yale in the fall of 2023 on the right-hand side, at the Institute last year, promoting this new program, the MPH Health Economics and Financing concentration. You see her wearing her loyal Yale sweatshirt there, t-shirt. That was certainly unprompted from my side. Next one, last one, I believe. So where are we on all of this? The timing of this meeting is really fortuitous because we're just about to launch this new concentration. I'm returning to Asia next week, to Cambodia, to teach one of the inaugural classes in advanced health financing. We need to keep revising and improving the curriculum in an iterative way in order to make sure that it meets the needs of the Cambodian and Laotian students and institutions. We're working on mobilizing additional funding for this. And we're very much aware that this training doesn't exist in a vacuum. There are policy decisions being made by both governments right now and various partner institutions. And there will be an active program of policy seminars and research to accompany the teaching that we're doing. And we're trying to assemble funding for those seminars and research and policy dialogue. And we're starting to explore with CMB Foundation and others the possibility of bringing in students from Myanmar, the third country that really has a huge deficiency in this area. In these photos on the left-hand side, you see the director of the institute on the far left, Professor Chorvan, and the Cambodian faculty who trained at Yale and will be teaching alongside me. Upper right are the Cambodian students who are attending the courses. I was in Phnom Penh in January and had a chance to meet and interview all of the students who are enrolled. And then you have on the bottom right, you have Myanmar and the important role that healthcare workers and the health system plays in the country's future. And I know the big deficiency there in terms of training in policy and financing for the future of that country when it's able to get back on its feet. So let me stop there and hand over, see if there are questions. Again, I want to just emphasize the value of this type of catalytic funding, whether it comes through YIGH or through other Yale programs. We have a wealth of sources to assist faculty and graduate students to launch initiatives of this kind. Thank you.
Well, Rob, thanks so much for joining us today after such a long journey. Really, really appreciate it, and also really appreciate the presentations from all of our panelists. Thanks very much.